mentioned the brain fog. I mean, your blood sugars don't even need, as a type 1 diabetic, I've experienced the brain fog. And it, even now, on a very close to carnivore diet, it would come back when my insulin pump fails and I don't detect that it's just failed to pump insulin in me. Something has gone faulty. For 2 hours, I'm without insulin, my blood sugars are rising. I get a brain fog. And then I'm back to normal when everything comes back to normal. But when I say high, people who are not even diabetic, who are not yet being diagnosed as diabetics, are showing those figures on CGM. I mean, CGMs of people without diabetes, they're constantly rising to levels which I, as a type 1 diabetic, would consider, oh, that's scary. I don't function well at those levels. But they're just constantly running high and low, or just running higher in general. And they think, well, I'm not diabetic, so, you know, I can enjoy my carbs.
It's a huge issue, because even to use Alzheimer's as an example here, this is an older study, but they did a prospective cohort study where they showed that the people with chronic hyperinsulinemia, so high insulin, but not diabetes, their blood sugar was normal, but the insulin was high, they had double the risk for Alzheimer's. And this is huge, right? There's so many people out there whose blood, well, you were mentioning high blood sugar. There's so many people whose blood sugar is normal, whether that's the fasting level or the A1C, because super high insulin is keeping the glucose normal. But I think there's so many people who are, we could call them carbohydrate intolerant, meaning they eat carbs. And, you know, if you eat, even a healthy person, if you eat carbs, it's normal for your blood sugar to rise a little bit, not a ton, not to have this huge surge. And I do think that, and Dr. Christopher Palmer, Dr. Shabani Sethi, there's psychiatrists now working in metabolic psychiatry. I don't think there's any debate anymore that blood sugar fluctuations can absolutely have mental health effects, anxiety, panic attacks, even bipolar. Like, there is absolutely a connection there. Maybe not for everybody, but keto diets definitely, well, that's beside the point. The wild and, you know, volatile fluctuations in blood sugar definitely affect mental health. And I think anyone who doesn't think that, look at all the road rage episodes that we have now, you know, out on the highways, or especially these, Dr. Brian Lenskis, he's out of San Diego. He gave a talk you and I were at a conference recently. He showed a CGM graph from a patient who was having panic attacks. Well, they weren't really panic attacks. It was hypoglycemia. And I think, again, this may not be true for everybody. I think it's true for a lot of people, and they just don't know it. I think there's, you know, so many people are so sick right now, whether it's a physical ailment, a chronic thing, or a mental health thing. So much of this is nothing more than unstable blood sugar. It really is.